Middle-aged men and suicide in Ireland. We're in Dr. Stephen's Hospital, Shay, today. You have years of experience of being a practitioner, working indeed nationally with men of all ages. And talk to me, your instinct about today. You've been here at something that's the lens is put on middle-aged men. Yeah. Good, timely?
Absolutely timely. I'm really conscious of men taking their own lives. It's something that visits me on a regular basis. And I don't look at the numbers broken down by age. I just see the total numbers, and I think that it doesn't turn up in the detail. But I'm absolutely convinced that post-recession we're living with an impact. And from what I heard today, it really brings in a focus around middle-aged men. Here we are. I'm not working anymore. I'm retired. I'm now officially older, but at the time when all those pressures are on us as men to be a provider, and if I was born in the 50s, so a middle-aged man was born in the 60s, he was taught his job was to provide, put food on the table and a roof above their heads. And if they're not doing that, what is it that they are doing? How can they be men? How can they see themselves as men? We heard about men not being able to put shoes on children's feet. All of that, and I think that the recession, and I've been listening to men, as you know, for 20 years, and certainly over the past 10 years, I've seen the reality of men who aren't able to do what they believe is expected of them, and the terrible depredation it has on their heart and on their spirit. It just really destroys them, and you know they do withdraw. Isolation. I mean, the stuff about isolation is really central. Here we are, if I'm struggling, I isolate. And then I isolate further, and I close in on myself and I isolate from all those around me. And the last step of isolation is taking my own life. That's the reality. That is the reality. And the picture of that is just really huge.
A combination of the different inputs you've heard today from statistics and from Shane's and Noel's input in relation to the report itself, was there anything that struck you or came across and said, okay, I've known that, or that's new, or where are you after listening and sitting in the energy of what you've listened to today?
I suppose that because of the man I am and the way I approach the world, I've seen all those different pictures in a slightly fuzzy way, and it has brought a huge amount into really sharp contrast. The thing that delighted me most was listening to Shane, and it was just to hear a young man speak about men and manhood the way he did, reaching into his heart and speaking from that authentic place. And I said it to him. So somebody said to him, his father is a lucky man. And I said to him, well, actually, he's the lucky man to have the father, because he didn't lick it off a stone. He got that heart and spirit from within his family, because you don't pick it up. You don't pick it up.
The recommendations are very clear in relation to really promoting awareness and campaigns and a relational approach. You've been part of New Conversations with and for Men for over 20 years in Ireland. That's really good to hear in research backed up in policy.
It's not the first time I've said, sure, we knew that, but now we have it in research. And we know from the men's health policy, from the work going into the men's health policy, when it's written down like that, we can lean on it, we can say, this is where it comes from. This is the truth. This is real. I have to justify turning up to facilitate men's groups, and that does that. And to sit there and see all the work going on, that is, a plethora of different kinds of work with men right around the countryside. Is just, for me, it's just incredible to sit at the back of a room and see 50, 60 people actually interested in men's health. And I know that there was a time when it was neither interesting or profitable to be interested in men's health, and it's a real treat. And to hear Noel say, that the roots of it come from Biddy O'Neill and Alan O'Neill sitting there chasing, making it work, making it real, and going right back to those really important meetings where we struggle to actually put words on things and to learn. We've all gone in different ways and we do different things, but fundamentally we still believe the same thing. Sitting with men, giving men attention, inviting them to step in rather than step out. And that's it. Inviting men to step in, making it safe for them to make it possible so they can step in. That's the piece. And you know and I know, people say, women talk, men don't talk. That, that's BS. It really is. That's not my experience of the world. I know, and I do it week in, week out. I sit with men and I hear the detail of their lives as they come really face to face with the best in themselves and also the worst in themselves. And that's the crux, that it gives them a chance to step in.
Finally, Shay, statistics and the stories can be heartbreaking in relation to suicide and the topic we're on here today. But to go away from here, what's your energy or your insight that you go, are you hopeful in relation to being in a place now, maybe even nationally, with our actions, with our health action plans, with our Connecting for Lives, that we're starting really new and significant conversations that will make a difference?
On one side my heart lifts and the other it sinks, right? On one side it lifts because we know what's going on. There's a huge amount of possibility. My heart sinks is just the reality of austerity we're living with, and we will be living with the reality and the impact of austerity for the next 20 years. And so I'm in that place. We know what we need to be doing, but the resources aren't there for us. In reality, the resources aren't there for us. I have to fight to keep a men's group going once a week for 15 men. The choice is, will I continue to do it as a volunteer, or will I insist on being paid? That's the reality.